Okay, good afternoon. My name is Peter Zanoni. I'm City Manager for the City of Corpus Christi, and we want to welcome you to a joint press briefing on COVID-19. This is a joint City of Corpus Christi and Nueces County press briefing that we have on COVID-19. We have these every day at 5 o'clock. They're televised by some of our local media, covered by our local newspaper, and the City of Corpus Christi posts them live on Facebook. And we do these to help educate the community of various perspectives, our average citizen to medical industry, first responders, and others in the business about what we have up to date with respect to COVID-19. So that includes daily stats on a number of persons that have tested positive for COVID-19 and other stats along those lines for those folks. We're also sharing good information to the community from these sessions, from scientists and experts in the field. And today we have our local health authority doctor, Dr. Ramachandruni, who's going to talk to us about an update from his perspective. He works at every one of our local hospitals and sees firsthand those that have the COVID-19. And so he'll talk to us a little bit today and to the community about what he's seeing out there and give an update from his perspective. So these briefings are meant to help educate the community. As we learn new information about COVID-19, we're sharing it with the community every day at 5 o'clock, Monday through Friday. So today I will do an update on our COVID-19 statistics, talking to you about the number of new COVID positive cases for residents in Nueces County. And then I'm going to give a quick update on an initiative that Councilman Ben Molina, City Council member from District 2, had recommended and that we're implementing beginning today. With me today is our Director of Health, Annette Rodriguez, and she'll talk to you about our next scheduled drive-through testing site. And so Nueces County was one of the first counties in the state of Texas to have a drive-through testing site where persons that have been pre-cleared for testing can come to give a sample so we can test to see if they have the COVID-19 virus or not. And then, as I mentioned, Dr. Ramachandruni, our local health authority, he is a private doctor, a medical doctor who specializes in infectious disease, and the city and the county have a contract with him. He helps us in our situations such as this, COVID-19, as a contract staff person to help us with his expertise. We're fortunate as a community to have him here. He is, as I mentioned, his background is in infectious disease, and that's perfect for what's happening today. With us today, as well as on Thursday, is Mayor McComb, who will speak to us about the Mayor's Disaster Recovery Fund, and as well, he'll talk a little bit about golf operations. On Tuesdays and Thursdays, both Mayor McComb and County Judge Barbara Canales speak at these press briefings and give the community input on some of the policy decisions they're making to keep the community safe and to save lives. And so after Mayor McComb, Judge Barbara Canales will provide some updates on the Nueces County orders that impact the whole Nueces County. She'll provide updates that were requested yesterday on Bob Hall Pier. We'll talk to the community about the situation on the pier, whether or not it's open. The judge will also talk about golfing and then also talk about more details on a dedicated COVID site where we can treat people. The judge has been working around the clock on that issue, and we've been assisting and attending many meetings with her, so that's what the judge will do. So with that background, did you want to translate? Do you want me to just go into the stats? I'll keep going, okay. Okay, so every day at 4 o'clock, we check in from the past 24 hours to see what's the situation in terms of new COVID positive test results. And between yesterday at 4 o'clock and today at 4 o'clock, we have updated information. And so between yesterday and today, we have 4 new confirmed cases in Nueces County. You may recall that a recent averaging that we did, this is as of a few days ago, our average number of cases per day was somewhere in the range of 3.5 or so. So having 4 cases still keeps us on that average trajectory. We're not necessarily over that hump yet, and so with the 4 today, that brings us to a total of 83 confirmed cases for Nueces County. As we talk about that curve, as a reminder, this Friday, Texas A&M will be here again to update the community on the extensive work they continue to do on the modeling for our 12-county region. They'll update us on things to include what that curve looks like in terms of projection of number of new cases, hospitalizations, and persons needing medical equipment. So 5 o'clock on Friday, that'll be a great update from them. So 83 total cases for Nueces County. That does include, of the 4, 3 were from the city of Corpus Christi boundaries, and then 1 is from the city of Robstown. So those 4 new persons, 3 from Corpus Christi, 1 from Robstown. We're happy to tell the community that we've had 0 deaths in Nueces County. That's one of the statistics we track. And of those 4 new patients, 2 were male, 2 were female, and so the distribution is still pretty consistent. We have 43 total males that have COVID and 40 females. And then we look at the age distribution. Our report that, by the way, is available online and in an interactive format as well as a tabular format. We have 9 age groups that we track the COVID persons in. The majority of the cases are equally distributed between the age bracket of 20 through 79. And so there's about 15 on average in that age bracket of 20 through 79. There's 1 person in the 80 to 89-year-old bracket and 2 in the 0 to 19 category. So yesterday, we talked about the hospitals would be releasing more testing information. One of our local papers slightly got that wrong and said that we'd have more positive test results. Yesterday, what we said is that the hospitals will be providing us tests, just number of tests, and they did do that. So today, we're reporting 1,175 tests analyzed in the laboratories, whether it's our laboratory or a private lab. The hospitals provided 126 tests performed in those commercial laboratory settings. Yesterday, as an example, they reported 0, and so they were busy working through the Easter weekend, and today they did report 126 tests that they conducted in the lab on specimens. So that's not positive cases, but that's just the number of tests they ran. So in total for Nueces County, we're up to 1,175 tests performed in laboratories, analyzed to confirm whether or not somebody has the virus or not. So in total, just a breakdown again of the of where are these cases within our county. There's a few cities in our county. So of the 83 cases, 70 are in the city of Corpus Christi, 2 in the town of Robstown now. There was one of the additional ones was in Robstown, so there's 2 there. There's 6 in the city of Port Aransas, and 5 in rural Nueces County for a total of 83. Now, as of yesterday, we began to report those persons that have recovered. And so of the 83 cases, yesterday we reported, and it's the same number today, 88 persons have recovered of the 83. And so that means that they've been out of quarantine, they've been in quarantine long enough, and they've had a subsequent test similar to the first one that has showed a negative result. And so 8 persons have fully recovered. Some of these are donating blood for the plasma effort that we're doing. Also, we're the leaders in that effort as well, and Dr. Ram will talk a little bit about that. And then finally, for those persons that are in the hospital, that number has gone down. And so there are a total of 3 persons still in the hospital that have the COVID-19. And the good news on that is all 3 now are not in the intensive care situation. In fact, several were taken off ventilators today. And so the 3 are still in the hospital but recovering, but out of the ICU situation. So that's some good news there as well. So that's a summary of the stats. The final thing for me, and then Annette Rodriguez, our health director, is going to come up and talk, is an initiative that we're doing at the request of Councilman Ben Molina of City Council District 2. He had the idea to honor our first responders and our medical professionals by doing something that we do well here, which is light up that Harbor Bridge with various colors. And so over the next 6 days, we'll be saluting our local police, fire, first responders, and then also our medical professionals in their honor, to thank them for putting their lives really at risk pretty much every day as we go through this COVID epidemic or pandemic. And so beginning tonight, our bridge color at the Harbor Bridge will be in red to show our support for our firefighter first responders. That'll be tonight and Wednesday night. And then Thursday and Friday night, the bridge will be entirely in blue, and that'll be to salute our police officers. And then over the weekend, Saturday and Sunday, the bridge will be in white, and that is to honor our medical professionals that work in our hospitals. That includes our doctors, our nurses, and it also includes, though, our team of over 100 persons that work in our health department, our joint city council health district. They're at the front line taking calls and working this situation from a countywide public health perspective. So white lights on Saturday and Sunday. And that's a great salute to those that are in the front lines during this pandemic. We want to thank Councilman Molina for the idea and for staff for getting that done pretty quickly. So with that, I'm going to turn it over now to Annette Rodriguez, our Public Health Director, who will talk to us about the next drive-through testing event that takes place this week.
En resumen, la última toma de pruebas el día de ayer resultaron 4 personas positivas al virus COVID-19. Actualmente en el condado de Nueces existen 83 casos confirmados por el coronavirus. Entre esos, 43 son varones y 40 son mujeres. La mayoría se encuentran en el rango de edades entre 40 y 49 años. En total se han llevado a cabo 1,175 pruebas entre hospitales y el Distrito de Salud Pública. De los 83 casos, 70 son residentes de la ciudad de Corpus Christi, 2 son residentes de Robestown, 6 son residentes de Port Aransas y 5 son residentes de áreas no incorporadas al condado de Nueces. 8 de los 83 casos se han recuperado por completo. Algunos de ellos han donado su plasma. 3 continúan en el hospital, pero se están recuperando. Durante la Junta del Concilio de hoy, la solicitud del concejal Ben Molina se decidió iluminar el puente Harbor en honor a quienes han estado luchando contra el virus. Comenzando hoy y mañana, las luces en el puente se van a iluminar color rojo en honor a los bomberos y paramédicos. El jueves y viernes, las luces van a ser de color azul en honor a los oficiales de policía. El fin de semana, las luces van a ser de color blanco en honor a los profesionales de salud y empleados de salud. De esta manera queremos agradecer el trabajo de estos empleados durante esta emergencia sanitaria.
Thank you, City Manager Zanoni and council members, Mayor, for that kind gesture. The next drive-through is scheduled for Thursday, April 16th at 8 a.m. At the same location, Memorial Hospital parking lot. It is important to clarify that there are multiple venues for testing. The Health District conducts testing by following the criteria that is set by CDC for surveillance testing. These tests are limited nationwide, and criteria has been set to prioritize those who are critically ill and have other health issues that puts them more at risk of developing critical symptoms. The reagents that are utilized for these tests are provided by the CDC and the Department of State Health Services, and therefore we must follow the criteria to be able to provide the test. The other type of testing is called diagnostic testing. Diagnostic testing is conducted by your medical provider in urgent care centers. Those tests can be prescribed by your physician and do not have to meet the CDC guidelines. If the test comes back positive, whether it is federally approved or medically necessary, the health district will contact the individual and conduct tracing. Contact tracing means that we will make sure people who were in contact with this person are socially isolated and following prevention protocols. This is to ensure that we are breaking the link of transmission and it is no longer being able to be transmitted from someone else who is not infected with the disease. For those people who have recuperated, We continue to reach out to them as there is a need for antibody-rich plasma they can donate after they have recovered from the disease. We are still asking those who have recovered to consider donating, as one donation can provide antibody-rich plasma to up to 4 critically ill patients. Thank you to all those that have already donated blood and to those who will donate in the future. I will now turn the podium over to our local health authority, Dr. Ramachandruni.
En resumen, la próxima toma de pruebas está fechada para el jueves 16 de abril. Es importante aclarar que existen varios lugares para la toma de pruebas. El Distrito de Salud sigue directivas del CDC. Las pruebas están limitadas a nivel nacional y priorizamos a las personas enfermas críticamente. Existe otro tipo de pruebas llamadas pruebas diagnósticas, llevadas a cabo mediante su proveedor de salud. Esas pruebas pueden ser prescritas por su médico sin seguir las guías del CDC. Si las pruebas resultan positivas, el Distrito de Salud va a contactar al individuo y realizar rastreos. Mediante el rastreo, nos aseguramos que esa persona estará aislada y no transmitirá el virus a otras personas. Aquellos que se han recuperado, continuamos contactándolos para obtener su plasma y mediante su donación podrán proveer con plasma rico en anticuerpos que podrá ayudar a pacientes enfermos.
Good afternoon. Thank you, everyone. I'm an infectious disease physician practicing in the local hospitals for the last few years and also a local health authority recently appointed in the health department at Nueces County. I'm here to give you my update on COVID-19 patient care in the hospital setting. No words are sufficient to describe the service and the comfort that our great nurses are providing to those patients. They always keep a smile on their faces, which is reassuring to the patients and us physicians as well. I thank all the nurses and all the healthcare staff for doing an excellent job. I'm a part of a team of physicians which includes pulmonologists, ER physicians, hospitalists, and other specialty physicians taking care of these COVID-19 patients in the hospital. What we've been seeing in the hospitals, the patients are elderly who have other medical conditions like high blood pressure, diabetes, obesity. They seem to getting more sick than the younger population. We've had 29 patients from the greater geographic area, which includes 17 patients from the Nueces County that are admitted to the area hospitals. The admissions are coming down in the last week or so, which is my observation, and also it's helping. And most of the patients are mild to moderate. They required only a few liters of oxygen, and they were discharged after they made full recovery. 8 patients needed ventilatory support at any given point of time. And out of the ventilator patients, unfortunately, we had 1 death yesterday. The patient belonged to Clayburgh County. The patient almost fought for 3 weeks on the ventilator, and he developed complications related to the COVID illness. My heartfelt condolences to the patient's family. And as far as the rest of the patients who are on the ventilator, they're showing great signs of improvement. In fact, today, as of today, we extubated everyone. There's nobody on the ventilator. Everybody's weaned off and they're on slight oxygen support. So we expect them to recover and able to be discharged home. I'm cautiously optimistic given the recent progress we made with these patients. In the last 1 week, I think we might have some idea about the best course of treatment for the sick patients going forward. And of course, it's a rapidly changing scenario with the ongoing research all around the world. I believe the convalescent plasma is a game changer for everybody. A little bit about the convalescent plasma. This is recovered from a COVID-19 patient. So they develop antibodies that neutralize the virus because they fought the virus, they got better. So this is the best antiviral treatment that we can have right now, as the drug trials for the antiviral drug trials take some more months. And also vaccine trials also take several months. So this plasma seemed to have worked in previous coronavirus situations, like the bad coronavirus we're talking about back in 2002, which is SARS-CoV-1, and Middle Eastern Respiratory Syndrome virus back in 2012-13. and also avian influenza virus and H1N1 virus. So these convalescent plasma seem to have worked and improved outcomes in those patients. So we believe that this will work for our COVID-19 patients. And there's been recent literature also supporting that. And you must have heard in the news about the convalescent plasma program in our county. I'm proud to say we're the first few hospitals in Texas that jumped on day one, got the approval numbers from these FDA plasma therapy, and we transfused the first 3 patients on April 6th, way ahead of all other hospitals. So far we have transfused a total of 5 patients, out of which we repeated on 2 patients twice. And we especially thank the donors, and this is of course a team effort. With the excellent support from the Health Department Director, Annette Rodriguez, Ms. Rodriguez, and Coastal Bend Blood Center, and also from the hospitals, we were able to fast-track it and got this going smoothly in the very first few days. Of course, we'll need more donors. We want to stay one step ahead of this virus and transfuse sick patients with this plasma on admission day number 1. That means out of all the patients we transfused, the last patient received the plasma on day 1, which is a remarkable achievement in my opinion, and that patient recovered in 5 days. He had severe lung damage from this virus, requiring 100% oxygen, and we were able to get him off the ventilator in a few days. Remember, all these ventilator patients have a high mortality or death rate, about 50 to 80%. So getting these patients out of the ventilator, elderly patients, is in few days, I believe there's a good hope. So 1 patient's plasma can save 2 or 3 lives. So about 250 to 400 ml of plasma we donate, and each patient can donate about 800 ml of plasma. So the criteria for the COVID-19 patient donors is they have to be asymptomatic for 14 days. They have to be exposed to the virus either with a positive PCR test or positive serology tests. And at the end of 14 days, we test them again, and if it comes back negative, they are ready to donate. And there is one more criteria where if they're positive once and they're symptom-free for 28 days, they don't need to be retested. And they can approach the Coastal Bend bloodcenter.org, and there is a website. You can fill the form, and they will help you guide the process. And from the health department standpoint, and the health department, of course, has been working tirelessly. I've been seeing them for the last 1 to 2 months, and they've been very proactive. And we are also, I'm very happy to say that we were able to secure the hydroxychloroquine tablets from the state to the local hospitals much earlier than any other counties. Because we applied first, we got them first. I thank the judge and city manager for their help. Judge got on the phone right away and got these medicines in a few days. So all the city and county officials are eager to help in every possible way. Finally, the good news is the measures are helping to bend the curve, hopefully, and we're seeing the results in terms of decreasing the burden in hospitals and also rate of spread of this infection in the community. And from healthcare professionals, we all thank all the citizens of Nueces County for doing an excellent job in keeping our healthcare professionals safe by staying at home and following the social distance measures for the last almost 3 weeks, although it feels like 2 months to me. And so with your help, we hope to have a swift end to this. Thank you. I'll now hand over to Mayor.
En resumen, no existen palabras suficientes para describir el servicio confortante que nuestros enfermeros han prestado a los pacientes, así que quiero agradecer el trabajo de los empleados de salud. Yo formo parte del equipo de médicos involucrados en el tratamiento de pacientes con coronavirus. Lo que hemos experimentado en los hospitales son pacientes, la mayoría adultos, mayores, con otro tipo de condición médica, como hipertensión, diabetes y obesidad, quienes se enferman más gravemente en comparación a los jóvenes. 8 pacientes necesitaron de apoyo para respirar o sistema de respiración asistida. El resto de los pacientes fueron dados de alta tras mejorar su condición. De los pacientes en respiración asistida, uno falleció el día de ayer. El paciente desarrolló otro tipo de complicaciones médicas. Los pacientes que están bajo respiración asistida están mostrando señales de mejoramiento. Me siento optimista al ver el progreso reciente en los pacientes, por lo que cada vez tenemos mejor idea de qué tratamiento llevar a cabo. En cuanto al plasma convaleciente, las personas que se han recuperado desarrollan anticuerpos que neutralizan el virus. Este es el mejor antiviral que tenemos hasta el momento y que ha funcionado de manera exitosa para tratar otros tipos de influenza. Me da orgullo decir que somos de los primeros hospitales en Texas que obtuvieron esta terapia experimental aprobada por la FDA para nuestro condado. Ya hemos realizado la transfusión en 3 pacientes el pasado 6 de abril y en total llevamos 5 pacientes a la fecha. El plasma de un paciente puede salvar de 2 a 3 personas. Así que exhorto a aquellas personas que quieran donar que acudan al centro de donación de sangre. La buena noticia es que los números de pacientes no han aumentado significativamente, por lo que quiero agradecer a los residentes al hacer su parte y seguir las órdenes de oficiales.
Okay, well, thank you. Just a word of thanks to the citizens of Corpus Christi. I think they responded beautifully on Easter Sunday, and many churches had drive-in and online services, and I didn't hear any. I don't know whether the judge did or anyone else of anybody violating the protocols that we have in place, but worship services were able to be held, and people were able to experience the worship in a different way, and that's good. And so I want to thank the citizens of Corpus Christi for working with us on this and continuing to express their religious faith, but it's in a different way. But I think the Lord probably appreciated some flexibility and the dedication and the effort that went into doing that. So I think it was a good Sunday, and I hope everyone had a good Sunday. It was beautiful weather. I also would like to thank the judge and talk a little bit about the golf courses. That became an issue at the end of last week, and she worked diligently with the golf course superintendents at the municipal courts and the private courses to figure out a way to stay within the guidelines and allow that physical activity to go on. And I think that was bolstered substantially at the end of the day with a letter from the Attorney General's office. And so I want to thank the judge for that and appreciate her efforts there. On about 5 days ago, on April the 9th, we did reinstitute the Mayor's Disaster Recovery Fund, and this is really kind of a rebirth of the Mayor's Hurricane Harvey Fund that we established a number of years ago so that we could help the local nonprofits that are helping people that are running into some issues in terms of their daily lives and loss of income and bills continuing to pay. And so we established that fund last, I think it was Thursday or Friday on the 9th. I can't remember which day that was, but it was about 5 days ago. And to date, I'm happy to report that the public has responded. The public has responded tremendously to other efforts to raise funds, and I applaud that. I think Corpus Christi has got a tremendous number of people that have big hearts, and they want to help. And so whatever pot you put your contribution in and it goes to help people, that's our goal, is to help as many people as possible. But to date, right now we have a little over $55,000 in cash with additional pledges outstanding that will be coming in, and we'll be making some disbursements probably tomorrow or the next day to some of those agencies that desperately need some additional money to help people meet their needs in terms of their housing, the housing assistance, some medical, some child care support, utility payments, and other things, because the first of the month has come and it's gone, and some of those bills are becoming due. So we just want to encourage people to continue to be big-hearted and support us on this. There seems to be a lot of increased chatter about the end of April coming and those that are wanting this thing to end. Let me just encourage you to continue to do what you're doing, following the guidelines. The quicker you continue and you stay focused on those guidelines, the quicker this will be over. We can't promise anything, but I can assure you there's nobody more interested in getting this, well, probably the medical people are more interested in getting this over, but the judge and we want to see this over with, but we don't want to see it over too soon so that we have reoccurrence. And so we're working to that end, and we're both committed to that. And I think that's what the governor is. We've scheduled, I think there's a conference call this Friday with the governor, with the judges and the county judges, the county judges and the mayors throughout the state is scheduled for Friday afternoon, and I don't know what he's going to relate to us at that conference call, but he may have some type of plan. But right now we're staying the course because that seems to be effective and be working. And I said earlier as we started this process, the one thing you want to maintain, if you can, is your sense of humor. And I saw one of the funniest pictures on the Facebook last night that I've seen in a while, and it was pretty creative. Somebody was at some store shopping, and he'd gone to the trouble to make a crown of noodles that are about 6 feet out, so that I guess he could, whenever he was walking, if somebody touched that noodle, they were too close to him. And I thought, oh, man, that's pretty creative. And he had a great sense of humor, and I'm sure the people in the store thought it was a hoot. But it just goes to show that we can try to keep our sense of humor and have a little fun out of this while we're still obeying the laws and the rules and stay safe. That's our number one goal, and that's our commitment, is to keep the city and the county as safe and healthy as possible. And again, I want to thank the judge for her efforts and ask her to come up now and give us some updates that she may have from the county.
En resumen, sigue habiendo muchas preguntas sobre si los campos de golf deben permanecer abiertos durante esta emergencia sanitaria. Los campos de golf sirven como foro para actividades esenciales como el ejercicio y pueden permanecer abiertos si las autoridades locales requieren protocolos de distanciamiento social y se siguen instrucciones de salud pública. Hemos visto a muchas personas aquí en el sur de Texas impactadas por el declive económico del COVID-19. Nos hemos asociado con la Fundación Comunitaria del Área de la Costa para aceptar donaciones, para distribuir a las organizaciones sin fines de lucro, para satisfacer las necesidades de las familias que necesitan diferente tipo de asistencia. Si usted está interesado en realizar alguna donación, las donaciones del Fondo Recuperación por Desastre del Alcalde se aceptan electrónicamente en la dirección www.cbcfoundation.org. El público nos ha apoyado y me da gusto informar que hasta el momento hemos recaudado más de $55,000. Continuamos trabajando con la oficina del gobernador para poder regresar a la normalidad lo más pronto posible, aunque hoy continuamos con las órdenes ya que están funcionando.
Thank you so much. Barbara Canales, Nueces County Judge. I also want to commend, I would believe, the 99.99% of Nueces County citizens who really did a great job this weekend as we drove around in Easter weekend compliance. It just really makes you feel good to know that you can ask everyone to make the sacrifice, and what better weekend to make a sacrifice than Easter weekend, and that was accomplished. I want to tell you that our beaches, we received beautiful drone video coverage showing that people were not only making certain that they were in compliance. Of course, we blocked the access for vehicles, but nevertheless, there was still a tremendous amount of opportunity, and I want to thank you for adhering to the orders and making certain that if you were on our beaches, you must have been there because you had direct access to them. So I really appreciate that, and it's just an unprecedented effort, and I think it will pay dividends to our citizens' health. I want to also give you a little bit of a recap with regards to Bob Hall Pier. I understand that that came up yesterday, and I want to tell you about that 0.01. Remember how I said 99.99%? So let me tell you what happened at Bob Hall Pier late last week. We had two individuals who thought that it would be, I guess, funny, and it wasn't, to go down Bob Hall Pier and tell people that they had COVID. This prompted CCPD to come to the scene, and sheriff's deputies and constable's office, and all three law enforcement agencies who have been working relentlessly out at our coastal parks and beaches to help keep everybody safe, determined that it was in the best interest of everyone that social distancing was definitely not being practiced and needed, therefore, to shut down Bob Hall Pier. We have always said the beaches and the fishing is second to none. We are so proud of our Gulf Coast, and it's to be treasured. but there's a responsibility that goes along with it. And so after many, many warnings and no disbursement, Coastal Parks decided to close the beach out of abundance of caution for people's public health and safety, and I support that. And if we find out who thinks it's funny to go down to Bob Hall or anywhere in Nueces County and make a false report that they have COVID, I promise you we will find them. And our district attorney has assured me that they will be prosecuted under the full extent of the law. This is absolutely no laughing matter, and we will make certain that those people are held responsible for their reckless and complete wanton disregard for everybody else's personal safety when they make these ridiculous claims that are baseless. And I know they thought it was somehow funny or a joke, but it's absolutely no laughing matter. And as a result, it cost everybody their fishing pier that afternoon. In addition to the fact that people were not social distancing. So what did we do? We have remediated that effort to make certain that we have increased signage regarding social distancing. And the pier was open for business as of this morning. It has the hours of 8 a.m. to 8 p.m., and we hope that you enjoy your fishing pier. We hope you catch a lot of fish. We hope that it is a great experience for you as a physical activity is good for our well-being. But make no mistake, they will be patrolled, they will be monitored, and if we cannot keep social distance, then the pier will be closed again. It's pretty simple. So I think that 99.99% needs to be appreciated and applauded. And as I said, that 0.01%, whoever you are, I promise you, if you pull that kind of stunt again, we will hunt you down and we will find you because we have cameras everywhere. And now we have eyes in the sky. So let's see how funny you think it is when you get arrested for making that kind of an accusation. That's how serious I am about that, and it goes anywhere in Nueces County. COVID-19 is absolutely a matter of life and death, and I take my responsibility very, very seriously. And so I want to make certain that everybody appreciates that when it comes to enforcement and that kind of a matter, that we absolutely have a zero tolerance. So back to the good stuff. I think that the orders that you know will expire on April the 30th. And as Mayor McComb and City Manager alluded to, we are always seeking guidance from our federal and our state partners. And so as we create, as they create a new direction, we too will make those evaluations. But our orders are still in place until April the 30th. And once again, if you have any questions regarding those orders, don't forget that you can email us at county.attorney@nuecesco.com. Now, I also want to address another issue that was raised quite a bit on the phones today, and that's whether or not these orders require masks. We do not require them. They are not mandatory, but they are highly recommended in public venues by the CDC, and we think it's a wonderful idea. And as I grocery shopped this weekend, I saw lots and lots of people wearing masks, and as you travel around in public arenas for those essential needs, you will see that people are wearing masks appropriately, covering their nose, pinching in, covering their chin, and it does help tremendously. If everybody's wearing these masks, we can very much protect one another. Again, they are not mandatory, and I want to make sure that we understand that. So we've talked a little bit about testing today, and you've heard a lot of good information about the statistics that we pose every day through these daily press briefings. But there has been a tremendous concern about our ability to test. And I'd like to address that by saying that since the beginning that we have become engaged as a county, late January, early February, we knew that we would be one of the 10 testing sites in the state of Texas. This is a great opportunity to be able to have this biological lab here in Nueces County. And although it didn't happen right away, very soon in the month of March, we were able to set up the second testing site in the state of Texas prior to having any cases diagnosed at all. We were very proud of this fact because it allowed us to have the opportunity as a city county health authority to be able to offer testing to our community in advance of private labs taking 3 to 5 days. We could be much quicker. We are still much quicker. We can actually test each person and swab them within a minute, and we use no federally funded resources for this. All of these resources come from your city, your county, and through the graciousness of the PPE donated and the staff from Driscoll Children's Hospital and Christa Spahn. We did this together as a community, and we continue to advocate in the strongest ways for all the resources that we need to continue testing at the highest level. We do follow the CDC guidance, and sometimes that guidance, sometimes, not all the time, can lead us to finding people who fall through the gap, where their particular symptoms do not match up with the CDC guidance that's provided, and we have used that as a learning opportunity to be able to extend the descriptive nature of when people call in and say they want to be tested. I'll give you a great example. When it came to the symptom of no taste and no smell, that was not a registered symptom at the beginning of our testing. But over time, it started to reveal itself as a symptom, and we were able to insert that in the calls so that when a caller came in and gave that as a symptom, that became a red flag for somebody to make further inquiry to see whether they met the guidelines for testing. Make no mistake, this county wants to test as many people as have the symptoms for COVID-19 as possible. We simply do not have the resources. That is, we do not have the viral transfer medium, we do not have enough of the nucleic acid to be able to test everybody that wants to be tested. That's why these guidelines are so critical. And so I think that it's very important that you know that as a result of having limited resources, there have been several times over the course of the last few weeks where we've run dangerously close to running out. But to our good fortune and to our tribute to our joint city-county advocacy, we have received the amount of resources we need, and we have never run out per se, but we do not have an abundant supply. These are not items you can buy on the open market. You cannot procure them. You have to get them through the state, and there's a process and a protocol for that. And I promise you, for anybody that knows me, I can argue with the best of them. I can yell the loudest, scream at the highest pitch. I will do anything it takes to make sure our people get the resources they need for testing. But make no mistake, we have done our best, and what we have is what we have. And that is why today I finished off polishing a letter to not only Abbott Laboratories, but in conjunction with Mayor McComb, with the RTA, with the Port of Corpus Christi, and with the South Texas Military Task Force and the United Corpus Christi Chamber of Commerce. And we will do our very best to get ourselves in line and in the queue for rapid testing with Abbott Technologies' new ID Now testing. Rapid testing that would be available, we hope, in the very near future, and we want to get ourselves in line. Just like we were proactive with drive-through testing, the second in the state, we also seek to be proactive with rapid testing. So whatever it is that you hear about us not testing enough, we are testing everybody that meets the guidelines. We are testing with every power that we have to make certain that we have all of the resources. And I believe that that is everything that you would ask of me as your county judge. And so I definitely want you to know that it's heartfelt when I hear of somebody who's hurting because they did not get the test that they need. It matters to me. And so anybody that thinks that we aren't doing enough testing, I can tell you we are doing everything that we can to make certain that everybody who meets the guidelines gets the test. And in the future, my sincere hope and prayer is that we can do it for many, many more citizens. This is all that we can do at this point because these are the resources that have been given to us. We have a current request into the state to get more. We are currently working with all of our legislative delegation to make sure our advocacy stretches our realm. And I will keep you posted as to our updates. Right now, I believe we have 92 nucleic acid reactant agents left, and that is the limit of our testing. But I promise you, before we run out, we will do everything we can to continue the flow of resources here to Nueces County. We have never, ever, ever been at zero, and we will never, ever, ever give up. So with that, I will wish everybody well today that is in the process of recovery. I think that was excellent news that Dr. Ram gave to us. That is the greatest news, personally, I feel like I've had in a long time, that we have hope in our community. We have excellent treatments in our community, forefront of convalescent plasma in our community. We have not seen the types of difficulties with recovery that other communities have had. So I am very grateful for Dr. Ram. And again, we are concerned about our region, and so we thank Dr. Ram for not just caring about Nueces County patients, but in addition, Nueces sends their condolences to Clayburgh for the loss of one of their beloved citizens. And with that, I'd be happy to take any questions.
En resumen, quiero agradecer a los residentes del condado por hacer su sacrificio y seguir las órdenes. Nuestras playas estuvieron vacías este fin de semana y le queremos agradecer. En cuanto al muelle Bob Hall, lo que ahí sucedió es que 2 personas creyeron que era chistoso ir al muelle y decir que tenían el virus. Oficiales de policía asistieron al lugar y tuvieron que cerrarlo. Como parte de precaución, cerramos esa área. Hacer un reporte falso de la posesión del virus lo llevará a ser procesado legalmente. Este tipo de broma no va a ser tolerada. Estamos incrementando los señalamientos en el muelle y desde hoy reabrió de 8 de la mañana a 8 de la noche. Si las reglas no se siguen, entonces tendremos que cerrarlo nuevamente. Las órdenes actuales van a expirar el 30 de abril y mientras no hayan cambios, esas órdenes continúan vigentes. Las órdenes de la utilización de cubrebocas no son obligatorias, sino voluntarias, pero su utilización va a ser proteger a la salud. En cuanto a las estadísticas y la habilidad de realizar más pruebas, nosotros contamos con un laboratorio acreditado para la detección del virus COVID-19. Nuestro laboratorio entrega resultados mucho más rápido que los laboratorios privados. Nosotros seguimos las guías del CDC y si los síntomas de los pacientes no conforman las guías del CDC, no siempre podemos hacer las pruebas. Estas guías cambian constantemente. Desafortunadamente no contamos con suficientes recursos para llevar a cabo todas las pruebas necesarias. Yo voy a hacer y hemos hecho lo posible por obtener todos los recursos para realizar más pruebas. Junto con otras agencias locales, estamos pidiendo realizar la prueba Rapid Testing y poder ofrecerla lo más pronto posible. Le quiero asegurar que estamos haciendo lo posible con los recursos con los que contamos. No nos vamos a dar por vencidos. Tenemos esperanza en el tratamiento de plasma y estoy muy orgullosa de nuestros profesionales de salud.
Okay, great. That concludes our joint city-county public update for COVID-19. I want to remind the public and the media that we'll be here again tomorrow at 5 o'clock. Tomorrow is Wednesday. We'll have another briefing on Thursday as well. Mayor McComb and County Judge Barbara Canales will be here Thursday. And then we want to make sure you're aware of the Friday at 5 o'clock. That's when our scientists from Texas A&M Corpus Christi will be back here to provide the community with updated modeling that they've been working on in connection with scientists from across the country and world. And it's localized to our county and, in fact, the 12-county region in the coastal bend. This is exceptional information. It's to help the community understand why orders are put in place and why it's important to stay home and social distance. And it also just gives them a chance to see a snapshot of what's happening and what is projected to come to our community. So it's great information. We're thankful for having that resource here, Texas A&M Corpus Christi. We're thankful for Dr. Miller, who without hesitation asked a team from her campus to help us out and help the community out. And so that's it for today. Judge Canales, Mayor McComb, Dr. Ramachandruni's here. I do need to say one more thank you to Dr. Ramachandruni. He's working pretty much around the clock as well. And he broke away today to come and talk to the community. We think his information was valuable. We're so glad he's a part of our team, and an excellent person, especially for this time, being a specialist in infectious disease control. So with that, we'll take any questions from any one of us that presented today.
How many community spread cases are from the county testing sites? Do y'all know that?
How many are from what?
How many community spread cases are from the county testing sites?
From the county testing sites, the community spread, I don't think we don't have it broken out. We know there's 25 persons, there's 15 persons in the community transmission category. So of the 83, 15 persons caught COVID-19 through community spread. And we don't have the breakout of who tested that person. Yep.
Okay. I guess there's been some concern about people who have not been presented symptoms but have died recently, and if they have potentially COVID-19 but haven't been tested, if that makes any sense.
Yep, we'll have either.
Or just individuals who have died who have not tested positive but might display symptoms pre-death or anything like that. Is that a concern of y'all's?
I mean, I'm unaware of anybody who's presented that type of situation or dilemma. I'm looking at the health authority as well. No, I've not done that. I will tell you that you have a tremendous team of healthcare professionals here, led by, of course, our infectious disease specialist. And I'm certain that if they, we would have known that if that had come to our attention.
So I guess you've discussed how options for people who don't qualify for COVID testing at the moment to go through private care, it seems to be?
Well, it's the same guidelines. That's the whole thing, is that sometimes we start off with one particular symptom and it may not meet the guidelines. And then over the course of 2 days, you may meet the guidelines. The one thing that I know is that I am not a doctor, although I always wanted to be one. I don't know where I should have done that, but I am not a doctor, but we have doctors that are making these calls. And so when you call 826-7200 and you speak with that person at the health authority, they will refer you down the line based upon the symptoms that you are presenting. And that's why it's really important to know, that we have very strong medical expertise. But sometimes it's possible, and I'm certain that it has happened, because I know it's happened, where the symptom did not match up with the guidelines. And that is terrible. But I will tell you, it becomes a teaching moment and an opportunity to tweak those guidelines and to use it as an opportunity to change the way the intake is received. And so we do the best we can based with the CDC guidelines, and they are uniform across the land. Right? But each health authority, each health department can make those decisions based upon, their expertise. And that's why we have not only Dr. Ram, but we have 2 other, I believe, we have Dr. Janicer and we have and Dr. Papanini and Dr. Janicer, who are also providing medical expertise so that we can make these accommodations for when it deviates. It's almost as if this virus is tricky. It doesn't always look the same across the board. And it can be very frustrating. But what we do know is if you're sick, we definitely want you to stay home. If you believe you have the symptoms of the COVID-19, you should definitely self-isolate. And you should definitely do everything you can to contact the health authority and allow the process to work. And sometimes there's going to be that one case or that one that did not work perfectly in those guidelines. And I think that was presented over the course of the last weekend. And that is what is going to help us change directions and make sure that we can accommodate for those new symptoms.
Okay, if there are no other questions, we'll see you all tomorrow at 5 o'clock. Go to our website for more information. We're constantly updating our statistics there and providing information for the community. Thank you.
Pay your utility bill or report a pothole right at your fingertips.